is.
Okay.
Looks like she's got a nice,
Got nice background effects. Thunder.
as much as I can sit here, I'm sort of beside Susan, I think.
And we have 3 tape recorders from Paulette Luhart, 2 from Susan Hart, and a video recording from Brian Connor.
Alrighty then. I think I'm already familiar with everybody who's here. I want to formally introduce myself.
I'm not knowing much.
To you guys, my name is Claudia Lucas. My background in public health is, as most of you know, I worked for the state for 9 years for the Massachusetts Department of Public Health. That's not where I started out with my life plans. Initially, before I worked for Mass DPH, I was actually working for the USDA Federal Wildlife Services. So while I was working there, and this was kind of at the beginning of the whole West Nile virus thing that was going on. One of the things that the USDA was doing is we were trying to track mosquitoes and trying to figure out where mosquitoes were located that could potentially be carrying the virus. They were contracted with the Department of Public Health to have someone go out in the field with them, basically do all of the mosquito trapping, collect them, sort them, ship them to the state lab. State lab does their thing, tells us what comes back positive, what doesn't come back positive. So we get an idea as to where in the state, specifically, or what town we might be affected by West Nile. That's how I kind of got into public health. It was not necessarily a conscious choice to do it. Now I couldn't imagine doing anything else. Though initially I started out in animal science and intended to be a vocational school teacher. It's funny how things work. So that's kind of where I started out. Started out with the feds and worked on the state level, and then eventually just kept on with the state, working with the district health officer. Kind of a Jane of all trades, whatever the issue was for the day, whether it was housing or septic or something environmental, vector-borne disease, whatever happened to come across our plate at that particular time was whatever I needed to do. I want to talk a little bit about local public health and what it means for your community, but I want to go over a little bit of the history of public health first. The history of public health is really, really interesting. There are a lot of little factoids in there that most people probably aren't aware of. But it helps to shed a little light and a little perspective on where we are now and why we're here. Okay, so where did this originate? Okay. We're going to go back all the way to 1620. All right, Mayflower lands at Plymouth Rock, December 21st, thereabouts. That's what we guesstimate from the records. By the time March came around, more than half the settlers died. Okay, they caught pneumonia. They died from malnutrition. There was inadequate housing. They died from scurvy. There were lots of diseases running rampant during that time. People weren't necessarily aware of that, but from a historical perspective, you can see that we had lots of what we would consider now major public health issues. But we're going back to the very beginning of when we first had settlers here, and these are some of the things that they were dealing with. The next big thing that happened is 1678, epidemic of smallpox. Now, I'm assuming that everybody here has been vaccinated for smallpox. Hopefully, at some point in your life, most of us have a little scar on our shoulder from where we got, or on the arm, from where we got the original smallpox vaccinations. This was a serious epidemic of smallpox. About 10% of the population also died from this. There still wasn't a very good understanding of how smallpox was transmitted. People looked at this as the next plague that was coming along. Now remember, in 1678, the population of Oz was small, very small number of people. So by today's standards, 10% of a population doesn't seem like it's a lot, but when you consider the number of people that were living there at that time, 10% is a lot of people. Just to kind of put things into a little bit of perspective for that. Okay. In 1692, there was a sanitary act that was passed, and it became one of the first laws, kind of the predecessor to our public health laws now. Basically, it regulated butchers, distillers, knackers, or slaughterhouses, soap boiling, because you're rendering tallow, fat, from animals in order to be able to do that, and also the sale of food. So we can trace this back to 1692, and we can see the very, very beginnings of trying to implement some sort of a public health policy. This is what they were concerned about at that particular time. Okay. Sometime later, again, there was another outbreak of smallpox in Boston. A third of the population is infected, 30% die. Look at the population, 15,000 people. It's not a lot of people. And 2,000 people from the city to get away from it. Again, they didn't have a good understanding of how smallpox is really transmitted. All they know is that this is a potentially deadly disease, and they wanted to get as far away from this as they possibly could. They started branching out a little bit into the western part of the state to get away from the large city environment. City environments at that particular time were really very, very dirty. It was not uncommon to have people throwing their chamber pots out the window into the street. It wasn't unusual for you to find dead cart horses by the side of the road. A lot of people that were homeless. Cities were very, very dirty places at that particular time. And being dirty places, and the fact that there wasn't adequate sanitation going on at that particular time, it led to other outbreaks of things like cholera, okay, which is oftentimes transmitted through sewage. Now, if we go back to England, we know that one of the worst outbreaks of cholera was actually pinpointed to a specific water pump on Broad Street. The person who investigated this went around and discovered that this pump that was being used was actually people using the handle on it who were contracting cholera from using this. Needless to say, that was shut down. Better understanding of cholera came about, and they understood a little bit more about how to mitigate the disease process. Okay. Getting a little closer to where we are now, June 1797, the General Court of Massachusetts authorizes the towns to appoint health officers or health committees for the first time. All right. So if you're considering, we're going back to the 1600s, this is, a span of 100 years or more before this started to come into effect. And lawmakers started thinking, well, this is probably a really good idea. We want to take care of the health and safety of the people that are in our cities. Primary duties of the health officers, as I had just said, cities were really, really dirty places. Health officers at that point had to remove muck from the streets, okay? They had to examine the docks. There was a lot of import-export going on. Unfortunately, with a lot of import going on, you also potentially bring in diseases over here. We all know, that rats particularly like to hide, in areas, dark areas on ships, and they would come over here, and that's a means of transmission for disease, either through their fleas or their bites. That's how we began to see a lot of things happening in the New World that we had never seen before, is that we're actually importing it. And the same thing goes on today, a little bit on a lesser scale. We're a little bit more aware of diseases and things that go on. At that time, 1700s, we're just starting to get an understanding of what's happening. Note that there was no germ theory going on at this time. It had not yet been established. And the other interesting thing about that is that the common mindset of people back then was when something happened, when someone got sick, if someone got sick from smallpox and died, if someone got sick from cholera, many, many people, understanding that, Massachusetts was a Puritan state, felt that this was, the wrath of an angry God. That's why these bad things happened to people. There was no germ theory at that particular time. They had to come up with a rational explanation. Or whether it was rational or irrational, they had to come up with some sort of an explanation for why this is happening to us. Okay. Now we're getting even closer. In 1849, the legislature directs that local boards of health be established in all the towns in the Commonwealth. Okay? And there are a lot of towns in the Commonwealth. This I found particularly interesting. Whenever I talk about this, a lot of women in the audience find that this amusing to no end. Thomas Plunkett, who was a resident of Pittsfield, and introduced the bill in order to establish a state board of health, was actually urged to do it by his wife. She had a good idea of keeping things clean. She made the connection, urged him to pass the law, and that's how that happened. And as I said, a lot of people that I give this particular presentation to get a little chuckle out of that. That, hey, really the primary driving force behind establishing laws for public health in Massachusetts came from a woman, not a man. So, they noticed that, there were, large, discrepancies between urban death rates and rural death rates. And that began to give them an idea of how this works and the bigger picture things. Cities were dirty, countryside was a little bit cleaner. Now in 1907, we start coming down to diseases that are referable to the state. In 1907, there were 16 reportable diseases. The biggest ones of these, the ones that people were most concerned about, were meningitis, tuberculosis, measles, pertussis, scarlet fever. All of those things ended up being reportable diseases to the state. These are still reportable diseases to the state. When you look at the new list that just about every board of health has of diseases that are reportable to the state, this has increased 50 times of diseases that are reportable. Smallpox is a reportable disease. Tuberculosis is very reportable. We don't think about it a lot because we don't hear it. In larger cities where there's a large immigrant population, and I'm going to pick on Westfield for a moment, they have a large immigrant population. There is not necessarily vaccination that goes on in other countries. So a lot of people that are arriving here are actually carrying active tuberculosis. This turns into a situation where the local health department has to quarantine that individual in their home, and they have to stay there. A public health nurse will come every day and give them their medication to make sure that they're taking the medication. When it's as serious as that, you have to weigh the rights of the individual to maybe not have to take something for an active disease against the welfare and well-being of the general public. That's what it really ends up kind of coming down to, is that you have an active case of tuberculosis. I'm sorry, but you need to be voluntarily quarantined or isolated in your home until the tuberculosis is no longer active. So we do see a lot of that happening. One of the most recent reportable diseases that showed up, and this showed up maybe about 5 years or so ago, and there was quite a bit of controversy over this, is chickenpox. Chickenpox is now a reportable disease. I'm sure that most everybody remembers when we were kids and we had chickenpox. Our parents wanted us to get chickenpox. You know, here, get in bed with your brother, he's got chickenpox. If you get it too, then we get rid of it all at the same time. You know, okay, no big deal. It is a big deal now. There are, a lot of times there are orders that are issued for school children that if they have chickenpox, they need to stay home. Okay. There is a particular driving reason. There are a couple driving reasons behind this. One is that there's a susceptible population to it. The idea that once you've had chickenpox, you're never going to get it again is a fallacy. You can have chickenpox more than once. Worse is that when you get older, you know, chickenpox can contribute to an older person having shingles. Anybody who's immune compromised can potentially pick that up. One of the primary cited issues for why varicella became a reportable disease is because at that particular time we were very, very concerned about the possible weaponization of biological products. Okay? So, and we were concerned about smallpox. Initially, when someone is presenting with chickenpox, a lot of times it can look like smallpox. They were, doctors and physicians, they didn't want to take chances with that. Better to isolate that individual. Let them get over what, you know, let them run the full course of having chickenpox, and you know, then they can, you know, come back to school and, you know, do whatever they need to do. But that was one of the primary driving forces behind having chickenpox as a reportable disease, because in the initial stages you really couldn't tell whether or not this person was presenting with smallpox or whether it was chickenpox. Really, really hard to tell. Another, you know, issue that is relevant to this, I don't know how many people remember some years back, we saw some cases of monkeypox. Anyone remember monkeypox? That you remember monkeypox? Okay. Monkeypox is similar to, is very, very similar to chickenpox. It's something that has never been seen in the United States before, probably would never have been seen in the United States, except for the fact that there was an exotic pet trade show. An individual brought in, for an exotic pet, a giant Gambian rat. Why anyone really wants a giant Gambian rat for a pet, I don't know. But, you know, there are fanciers of a lot of these, you know, different unusual animals. Well, as it turns out, giant Gambian rats tend to carry monkeypox. So there was a handful of people who got sick from it. It presents a lot like smallpox also. Imagine you're the attending physician and, you know, you look at this person who has pustules all over them, it looks like smallpox. You don't know any better. And your reaction is going to be, oh, now what are we dealing with? Fortunately, there were just a few isolated cases. We understand now where it came from. We understand that prairie dogs, you know, can potentially carry it. A lot of these exotic pets that are coming in potentially can carry diseases that we have never seen before in the United States. Could be endemic to another country, but whenever something like that comes in here, and we've never seen anything like this before, kind of like West Nile virus, initially when the CDC was investigating this, they thought it was St. Louis encephalitis. Turned out not to be. They ran the tests, they got samples from the World Health Organization, compared them side by side. It was a 99.9% match to it. We had never heard or seen of West Nile virus or West Nile fever before it hit the States. So we're seeing things on a regular basis that are popping up that we've never seen before, and sometimes we don't know how to deal with it. So it's important to stay on top of, you know, what diseases are reportable, what new diseases are coming out, and how are we going to handle those kinds of things. again, same here, the state appoints 15 district health officers to establish local boards of health. Now, out of those 15 district health officers, in 2013, we're down to one. We're down to one that covers the entire western part of the state. That position may eventually be phased out at some point. It seems that these things tend to run a cycle. We've noticed that district health officers will be phased out over a period of time. Many, many years will go by before someone at the state level says, hey, you know, I think it might be a good idea if we reinstate district health officers. And so they'll reinstate them. But it's kind of an ongoing cycle, you know, every 15 to 20 years, this is going to flip-flop, it's going to change. So if we go back to the point where we do not have any more district health officers, wait another 15 years, they're going to come back. This is a biggie. I think that most people who have read the history of diseases and taken history courses have heard of the 1918 influenza pandemic that occurred in this country. Worldwide, we had 20 to 40 million deaths, right? Mostly working age adults. Pregnant women were severely affected by it. And to this day, in spite of all of the other deadly diseases that we have, I mean, we're counting HIV, we're counting tuberculosis, we're counting, you know, secondary, you know, deaths due to secondary infections. Influenza is still the biggest killer of people in the United States. That's why it's important for people over a certain age to get a flu shot. Flu shots can kind of give some people a little bit of a false sense of security because there are so many different strains of the flu. It is practically impossible to create a vaccine that is going to take care of all of them. So just because you've had your flu shot doesn't mean that you might get another strain of the flu that didn't have to be covered under that vaccine. And being a virus, viruses mutate very, very quickly. Very, very quickly. It can happen, it can literally happen almost in the blink of an eye, where suddenly you're getting these viruses that are no longer susceptible to vaccines. So I find viruses very interesting. A virus is actually, it's, a lot of people have asked me what is the difference between a bacterial infection and a virus. A bacterial infection is actually a living organism. A virus is not. A virus is basically a non-living particle that when it invades your body, it's using your immune system, your defenses, in order to replicate itself. It gets inside the cells, changes the DNA pattern, starts replicating more of itself. But a virus is not a living thing. And that's an important difference to make, because some people will say, okay, well, I think I've got a virus, so I'll go and take antibiotics. Antibiotics don't work against viruses. Antibiotics work against bacterial infections. If you have a virus, the most that you can do with that is administer supportive care to the person that happens to have that. These next series of pictures are really, really interesting. This actually was taken on the grounds of the Brookline, Massachusetts hospital. There was such an overflow of patients from influenza, the hospital couldn't handle them. They basically built a tent city on the grounds. That's what it looks like. This is what was taking place outside the hospital because there was not enough room there, and not enough staff, not enough beds to handle the huge degree, the huge number of people that were infected. So, looks really primitive, looks kind of like a shanty town, but they didn't have the resources to deal with this kind of thing. So we ended up with that. Okay. How disease reporting works. Why how people get curious about this. I call this kind of a trickle-down effect. What basically happens is that when something shows up on the radar, when something looks like it's going to turn into a pandemic situation, we generally, the CDC, which is a federal agency, will issue a general warning and will issue it to the state health departments, okay? So the CDC basically oversees disease control, but they're the ones that are responsible for reporting these things to your to the state health department. From the state health department, then it trickles down to the local boards of health to make them aware of what's going on. But it always starts on the federal level. Okay? Then it goes to the state, then it's going to come down to the local boards of health. Once it comes down to the local board of health, we're the people that have the manpower on the ground to deal with it. State doesn't necessarily have that many people to be able to cover the number of people that live in Massachusetts. So you can see how important the local board then becomes, because we need to figure out some way of dealing with a number of people who are ill. So that's kind of how the disease reporting works. If you wanted to go a level higher than the CDC, you would be talking about the World Health Organization, the acronym being WHO. The World Health Organization and the CDC are very much on the same level. There's very little that the World Health Organization has information that the CDC doesn't have. But if you wanted to go one step above the federal level, okay, then you're dealing with the World Health Organization. The World Health Organization can actually provide some very, very useful information. For instance, it was the World Health Organization that discovered in 1970 that smallpox had been eradicated worldwide. They reported that because of the vaccines and such, it was believed at that time that smallpox had been completely eradicated worldwide. The only places that would even have smallpox for any reason would be the government, CDC, they may have it in vials. World Health Organization may have it in vials. For test purposes only. But, so it still exists out there somewhere. Hopefully it's going to stay in a lab and it's not going anyplace. But there are only 2 entities in the world that have any kind of access to the smallpox virus. Okay. Now we're getting kind of into the, what is the scope of local public health? What do we do? What's our oversight? Little factoid for you. I love trivia. In Massachusetts, there are 352 cities and towns. That's a lot. They are served by over 1,000 Board of Health members, okay, and 7 commissioners. The majority of these are volunteers. And think about this, every one of those 352 towns has a health officer, or they have a Board of Health. Okay, that's mandated by the state. They have to have it. Even if it doesn't function super well, it still has to be there. It still has to be in place. That is a lot of health departments, and there's a lot of agents that you're dealing with. Another little interesting bit of information, and this really pertains a lot to not only local boards of health, but also to town government, is that Massachusetts is what we call a home rule state. Okay? Basically what that means is that local cities are able to set up their own system of self-government without getting interference from the state. Okay? It shifts a lot of the responsibility for what's going on in your town from the state level down to the local level. And this is a really good thing in a lot of ways. There are some instances in which, or some cases in which, the home rule state doesn't apply to the towns. But by and largely, this has been set up so that the state can't come into your town and tell you what to do. Town sets up their own policy. sets up their own procedure for things. Okay. And here are some of the exceptions to home rule. Okay. We are still subject to the restrictions held in the state constitution, or rather the United States Constitution and state constitutions. It's not, while this is not restricted to only things specifically authorized by state law, I mean, the federal law impinges on this too, okay? So while the town can make bylaws about things, while the town can come up with policy on things, it can't be in conflict with state or federal law or mandate. That still trumps the local board, right? That's an important thing to understand, is that even though we do have some autonomy to make decisions and to decide things on what's going to happen, we can't override a state or federal law. What are we responsible for? We're responsible for disease prevention, control and health, environmental protection, promoting healthy communities. That's the big thing. That's the big buzzword these days, is that, you know, your local board of health is here to promote a healthy community, to protect the citizens of that particular community. That's one of the biggest responsibilities that a local board has. Okay. We also serve Ashfield, we'll use Ashfield as the example since we came over here, is that we basically serve as the local arm of the State Department, or we say the local arm of law. Right? And we also, you know, work in conjunction with environmental protection. So we can be the enforcing authority on these things on our own, in our own town. There we go. Okay, so to fulfill duties, we develop, implement, and enforce health policies. All right. We oversee inspections to maintain minimum standards. We inspect food service. We want to make sure that the basic needs of the community are being met at as much of a level as we possibly can. Okay. Local Board of Health is ultimately the determinator of whether an activity or whether a situation is really posing a public health threat. It's deferred to your local health officials to make that decision on some of those things as to whether or not something that's going on in town really is a public health threat, or whether it's kind of on that line, whether it's on that borderline. But ultimately, you know, we're that governing agency that makes those determinations. A lot of times it's in the bylaws of the town. A lot of times it's in policy of the Board of Health. Just about every board has policy and procedure that goes with it. Okay? So this is, you know, these kinds of things, you know, are left to our judgment, you know, our bylaws, our policies and procedures, and that's what we follow. Again, not stepping on toes of the state or the feds, you know, if this is something that they have more general oversight of. But by and largely, this, you know, comes back down to the local health department. Now, these next slides I find really amusing, if for no other reason than it shows you how sensationalistic things can become, and sometimes how sensationalistic the media will treat a certain situation. Working for the state, I was on the receiving end of that a few times. You know, I get panicked phone calls from people. Have to explain, nothing to worry about with this. Don't believe everything you read in the paper. Think about it. You know, gather your facts, think about it, filter it, and come to a reasonable, rational conclusion. You know, the flu is coming, the flu is coming. Okay, yeah, the flu is coming. Right? You know, how is that different than 5 years ago? You know, this particular one happens, you know, to be the flu. Now the kicker is this one in the Boston Phoenix headlines. You're all going to die, all right? And yes, you should be afraid of avian flu. That is one of the most sensationalistic things I have ever seen in my life. Talk about spreading mass panic among people and making them overly concerned about something that, you know, oh my God, I mean, this thing is going to come into my community, it's going to creep in my window, it's going to kill me. Well, yes, I mean, sometimes, you know, you need to be aware. In this case, you need to be aware that there is such a thing as avian flu. You need to know that, you know, it's the H5N1 virus that's causing this. You might get sick. Does it necessarily mean that it's going to kill you? No. The most susceptible populations are going to be the very young, the immunocompromised, and the elderly. Right? They're going to be most affected by this kind of thing. But this, I like to use this as an illustration of don't believe everything that you read in the newspapers. Okay? They're in the business of selling papers. They're not in the business of dispersing actual fact. That happens more often than not. It's a sad state of affairs, and there should be okay. Just about every health department has a copy of this manual. I have a copy myself. It's a guide to surveillance and reporting. There have been some revisions made, but it's going to give, what it will do is it's going to give you a checklist of diseases that are reportable to the state. Okay? It'll also tell you, you know, about how that particular disease is spread, where you can find it, which populations are most at risk. So it's a very, very useful manual to have so that you can go and double check the facts against it. Someone calls you up with a question for swine flu or brucellosis. Actually, brucellosis or listeria. Those are two, you know, really, really good examples of diseases that are reportable to the state. You want to know if you have, you know, frantic caller on one end of the phone and they really don't know, you know, what to do. Grab your book and look at it. And it's going to tell you everything in there that you're going to need to know about it. How this is transmitted from, you know, whether it's because you're drinking, you know, raw milk or soft cheeses, listeriosis, often, you know, caused by, you know, eating deli meats, that kind of thing. Know where it's coming from, so that we can better evaluate your risk. Okay. We also do a lot of environmental surveillance. I talked earlier about the surveillance that we did once upon a time for West Nile virus. This photo here was taken in Brimfield. Basically what I'm doing is I'm setting up a particular kind of mosquito trap. Two kinds of mosquito traps that are used for collecting specimens. This particular trap basically looks like a toolbox with a battery in it. Okay. What happens is you set it up over a pan of dirty water. Usually you would make a slurry or a vanilla or something like that. Because the mosquitoes that are transmitting the virus have a preference for where they're going to lay their eggs. So we know if we provide stagnant water that has a high organic content in it, we're very likely to catch the mosquitoes, the species that we're looking for. So with this trap, the mosquitoes are going to go under there, they're going to be looking for a place to lay their eggs after they've taken their blood meal. The battery inside it, you can see right here, it's like a huge 12-volt battery. Hooks up to an internal mechanism for a fan. What happens, the mosquitoes get under there, get sucked up by the fan, gets put into the Tupperware container, and there they stay as long as the fan is running. There's no way for them to get out of that. Following day, we'll go pick up the traps. And we'll just, you know, there's a little sock underneath it, tie off the sock, take that whole Tupperware container, put it on dry ice, take it back to the office, do your sorting of your mosquitoes. You got to sort out moths and mayflies and all kinds of things, because so many things can, you know, accidentally end up in these things. You just want to be picking out the mosquitoes. So we would bring those things back to the office, we would dump them out on a tray, and very painstakingly with a pair of tweezers start sorting the mosquitoes. out from the rest of whatever happened to be in there. The reason that we use dry ice for this is because it puts the mosquitoes into hibernation. That's a good thing. Very difficult to sort mosquitoes that are buzzing around. Very, very difficult to do that. As long as they maintain at a cool temperature, they're going to be in a state of hibernation, and it's very, very easy to pick them up. As soon as those little guys start to warm up, you can see them start to twitch on the tray, and sometimes you're going to see some that are about to take flight somewhere off in your room, go up into the air vent. Okay, we're in the back office. We're not going to tell anybody that we just lost a mosquito. But anyway. So mosquito trapping is one of the things that we do. This is one kind of trap that is used. Setting it up in kind of a swampy area, a place that we kind of scoped out a little bit, thought, oh, no, this might be a good place to set up. We might have a good proliferation of mosquitoes around here. So we look for areas like that. One of the most common places that we set up mosquito traps were cemeteries. The reason that we set up in cemeteries is because there usually is a huge accumulation of standing water in the flower pots, things like that. People that are bringing in barn notes tend to collect standing water. A lot of times there's organic material in there. More often than not, we would go town to town. In one day, we might hit 5 different cemeteries and set up our traps and see what we pull up. This is an interesting photo because this is the first time that we had ever seen a hawk or a raptor that was dying suspiciously of what we thought was West Nile virus. We knew some things about West Nile at the time. We knew that there were susceptible populations and bird populations, corvids, primarily crows and blue jays. Okay. We're not quite so sure about raptors and other species that could potentially be susceptible to it. So this hawk was brought in by someone in the community. I had never seen this kind of thing before. I wanted to get measurements on it to determine what old is this thing potentially. It's a relatively young hawk. It's small, it's a juvenile Cooper's hawk. But that helped a lot in trying to figure out the susceptible populations. It wasn't an adult. Does this mean that all young hawks don't have the immune system, don't have the immunity that they're supposed to have to fight on this kind of virus? This bird came back positive for West Nile virus. Other photo here. That was taken in Great Barrington some years ago. Again, we did environmental surveillance. We were concerned about the proliferation of tick-borne diseases going on in the area. Now, we already know that Lyme is endemic around here. I mean, every other person that you talk to has probably had a run-in with Lyme disease. What we were beginning to see in the Berkshires through doctors' reports were that people were becoming infected with ehrlichiosis, which is another tick-borne disease. Ticks can carry more than one disease at a time. If you get bitten by a tick, it could be infected with Lyme disease, but it could be concurrently infected with ehrlichiosis or babesiosis, all of which are tick-borne diseases. They can carry all of those at the same time. It makes it, double or triple jeopardy for the person who gets bitten by a tick, because you don't really necessarily know what you're picking up. The reports that we were getting of people coming into local hospitals and testing positive for ehrlichiosis was happening out in the Berkshires. So we figured that, probably one of the best ways to determine what areas of the southern Berkshires were affected was to go to the deer check-in stations during hunting season. And when the hunters bring their deer in, we would comb them out for ticks. And we put some ticks in the vial. The other thing that I would do is I would take blood samples. Now, mind you, the deer has already been feeling dressed and gutted, and so there is no blood pressure But on the interior cavity, no matter how well scraped, you're still going to have some blood residue in there. So it's able to pull that out in a syringe, send it off to the state lab. And lo and behold, some of those deer had heals. It's what carrying it. So that's just another form, of environmental surveillance that goes on. It's, we're going to be looking for vector-borne diseases. Ticks are a big deal. Okay. Now we get to housing. Housing and disease reporting are equally important. Those are the two really, really, really big things that local boards of health deal with. Disease surveillance and reporting and housing issues. Okay. When we deal with housing issues, this is the particular statute that we're using. It's 105 CMR 410. It's the state sanitary code, or in other words, it's the minimum standards for human habitation. Understand that what the bottom here says, these are the minimum standards, okay? That is the very, very baseline that determines whether or not a place is habitable. All right? If the minimum standards can't be met, then we're potentially looking at condemnation of the property. So when someone requests that we go in and do an inspection of the home, apartment, or any kind of dwelling unit, it could even be a hotel room. This is what we use, the state sanitary code, and looking for the minimum standards that are necessary for human habitation. Okay, and a lot of those things are very, very basic. You need to have hot water. You need to have heat. You need to have it free of infestation. Those are just, a few of the things. And a lot of these things kind of seem like no-brainers to most people. But when we do our inspections, we're just checking for the minimum standards. And that's all. If there is a reason to go back and try and find other issues that are a little bit above those minimum standards, then we're starting to get into some other codes. But this is typically what we're going to use when we go into someplace. Okay. What we see of our community from the outside, this is what most people see when they look around at their communities. They see nice houses. They see well-kept buildings. They see really, really pretty streets. Okay? This is what most people are going to see when they start looking around at their community. This is what we don't see. Okay? This is what you do not see going on behind closed doors. All right? Hoarding. Huge problem. Okay? This is not an unusual thing to see. I have actually seen much worse than that. This is an actual photo that I took of somebody's house. You can tell that's a person's kitchen because there's a stove there. But it doesn't really look like it's much of an operable stove because there's so much stuff on it. This house actually ended up being condemned. The unfortunate part about that was that the homeowner refused to leave, even though it was clearly unsafe for that person to be there. And he was elderly as well. Just because you condemn the property does not necessarily mean that, and you issue an order to vacate, doesn't necessarily mean the person's going to leave. Okay. When those sorts of things happen, that's when we ramp it up to the next level. And we bring it to housing court and get a court order from the judge that this person needs to leave because the house is condemned. They can no longer stay there. Okay? Another thing that goes on behind closed doors, and we never know about it, this is the makings of a homemade explosive. Happens a lot. see them off. About 3 or 4 years ago, we found a meth lab in South Hadley. That's on Facebook. Nobody knew it was there. Nobody had any clue that it was there until local law enforcement started picking up on some things that they thought were a little suspicious going on. In effect, it essentially turned into a 3-ring circus. We had hazmat show up. We actually had people, personnel from the FBI show up. We had state officials there. We had the bomb squad there. We had the local board of health there. Meth labs are nothing to fool around with. They are very, very dangerous. Okay? It is not just dangerous for the person who happens to be living in that house, but it is a hazard to everybody else that is living around that. Okay? Meth labs, you think, a lot of people think of meth labs, they think, oh, you know, Oklahoma, that kind of thing. It happens here, it happens in the backyard. But you don't necessarily know that it's happening. So these are the things that we don't tend to see when we look at somebody's house. Okay, minimum standards again for human habitation. How many violations can you spot in these pictures? Anybody? Don't be shy. Yes.
No handrail on the stairway, that's pretty minor, huh?
What's that, sir?
No handrail on the stairway.
Yep.
Is that opening, is there any window in there, or is that just open? It's hard
This
to
slide or
tell.
this one?
The right one,
This one?
yeah,
There is no window there.
okay.
Okay. When I look at these kinds of pictures, I can see all kinds of code issues going on here. The first picture, the individual who's in the house, this was staged for a training video. The person who is staying in the house actually was the health director for the city of North Adams. He agreed to play along with us and do this, and he was absolutely fantastic at what he did. You can see there is no screen in that door. The windows are boarded up. The roof looks like it needs to be repaired. The siding is coming off. That deck, not only is it missing essential handrails there, but structurally, and you can't see it from the picture, but structurally it wasn't sound. You could feel it give in your weight when you stepped on it. Okay? So I mean, there were numerous violations in that particular property. Fortunately, it had already been condemned. We were just borrowing it for a few hours so that we could put a training video together. This particular house, again, this was condemned. Okay? Same individual did not want to leave his house. Right? He had no running water in his house. He had no water in his house. He had a stove, but you can't get to the stove. Right? He had no means of heat for the winter. Right? The interior of this house, you can see, this is an old house. Plaster's coming off the walls here. Plaster's coming off the walls there. There's an open window that has no glass, no screen, no nothing. That's a pretty scary zone. It was a very, very unfortunate situation, and this person didn't see anything wrong with the way that he was living. And he, certainly had his right to, say that this is the way that he wants to live. But we were looking at this as a huge public health hazard. Not necessarily because of the individual that was living there, although we were very concerned about his health and well-being as well. But when you're taking into consideration the public, you're taking into consideration fire, police, EMS. Okay? If that house burned, the fire department is required to go in there to find someone who is alive if they can't get out. You just endangered someone from the fire department. Okay? You may have endangered the police department. You may have endangered EMS. Those all count as being part of the public. Okay? We have to look after them too. in these kinds of situations. This is just, you know, a completely unacceptable, you know, dangerous situation to walk into. The house is no longer there. We were fortunate that we were able to get the individual out and get him the care that he needed. And a year later, that house was raised. There was nothing that could be done about that. But, wow, that was a 3-year fight to get this taken care of and get this individual into a safe place where he can actually have a job and take care of his needs. But we do it here. I wish I could put a picture of the back of the house there, because what he was doing for washing and cleaning himself was he was basically collecting rainwater in barrels and washing in the barrels outside. I hate to see what that would be like in the wintertime. But there was a lot more, you know, going on here than just, you know, the couple of slides that I showed you one of the ideas and then one that's going on here. If you look at the back of the house, you would have seen, you know, that there's a tub that he was using for bathing and stuff like that. Okay. Hoarding. This is an issue that comes up very frequently. It's a very common housing issue. It's probably one of the most common housing issues and the most frustrating to deal with on the part of the health department and the health officer. Okay? Hoarding, in essence, you know, is the excessive collection of materials. Could be anything. Could be newspapers, magazines, coffee cans, animals, old cars. In some instances, there have actually been people that will, as horrible as it sounds, will save their urine and will keep it in jars. Why? I'm not really sure what that's about. But, you know, obviously they have their own thing going on. This is not an unusual thing to see. And you can see, you know, how dangerous this kind of a situation is becoming, because not only do you have all this stuff all over the floor, but look at all these wires that are running underneath things. And that's a fire hazard. Okay, we get back to protecting public health and safety. The fire department has to respond. This is a smoke-filled building. They have to go in there and find somebody. It's practically impossible. When you don't see anything, if you can't see anything. Typically, this is how hoarding goes, okay? It's a vicious circle. It starts with a complaint. An order will be issued. A cleanup will take place. The individual will begin collecting again. They'll go back to the complaint. They'll go back to the order. And you go back to the cleanup. And while the person's collecting there. It's cyclical, it happens frequently. Towns that get involved in these kinds of situations often do something that is called a clean and lean on the property. What they'll do is they will come in and they will pay for the cleanup expenses. But in lieu of having the town having spent that money to clean the property up, they're going to lien on the property. And it's a primary lien, meaning that even if there are other stakeholders here who may have liens on the property as well, we're first in line to get our money back on that. Okay? This is how, I mean, in my career, it's happened, you know, more than a few times that local health departments have had to go that way. Clearly, you can't manage this situation by yourself. We will try to help you as best we possibly can. But when it gets to this point, you know, we do have to issue the order. The town oftentimes will do the cleanup, and then they're going to put a lien on the property to recoup their expenses. Animal hoarding. Another component of hoarding that is particularly difficult for a lot of people. It is the excessive collection of animals of any type. whether it's cats, dogs, birds, horses, whatever. The hallmark sign of something that's going on with animal boarding is when you see this kind of situation. And 4 litter boxes, completely dirty, the house is filthy. It's clearly an out of control situation. And the unfortunate part about this, and I always feel bad, I feel bad not only for the person who owns the pets, but I feel bad for the pets as well. A lot of times this starts out with good intentions. You know, they want to take in animals and rescue them and get them off the street to live a better life. But before you know it, you're overrunning the cats. You're overrunning the dogs. I understand their attachment to their pets, but I also know that they have a right to their well-being as well. A lot of times, things like this will go to court, and orders will be issued for an agency like the NSPCA to come in and remove the animals from the house. These are some of the things that we can help you do, all right? We can provide you with inspection services. That's not unusual. We get a lot of calls for inspection services. We can help resolve landlord-tenant disputes. Oops. I did that. Okay. That's usually in the form of an order, all right, that we're trying to sort this out, sort out the dispute that's going on between the tenant and the landlord. We can help people take a case to housing court. If you've never been to housing court before, it can be very daunting. A health agent or a member of the Board of Health can help walk you through the process of how it works. So these are things that, services that we can provide to the community to help you to resolve some of the issues. All right? Okay, what the Board of Health cannot do. Okay. We cannot force our way in to anybody's apartment or house, okay, unless we are expressly invited in, and we can't trespass. All right, Susan, I'm going to pick on you for a moment. Okay? Hope you don't mind. I have a suspicion that maybe the interior of your house is leaving something to be desired. Okay? As the Board of Health agent, I don't have the right to go to your house and kick in your door. Okay? And tell you what to do. All right? I don't even necessarily have the right to be on your property. That's trespassing, okay? Can't do that. If I need to take pictures, take them from the road, all right? But don't tell a lot of health agents this, when they're starting out, your intentions are good, don't set even a big toe on that property, or you're trespassing, okay? That makes everything else null and void. Now you have a criminal complaint against you for trespassing. Your intentions were good, but protect yourself, okay? You're not going to force your way in. You can't go in without an invitation, all right? And you can't go into someone's property without their express consent. Moving on, Title V inspections. Title V is another biggie. This is something that a lot of health agents like to see trainings on, because Title V or septic inspections, particularly up here in the hilltop areas where there isn't a town sewer, okay, you're going to have an unlocked septic system. All right, so one of the things that we do is we inspect the septic systems. We can install them. Some of us are engineers. We can install a brand new septic. Sometimes we can authorize repairs to happen on a septic system, okay? Not everybody is necessarily a licensed Title V engineer. I'm not. Not everybody is necessarily a licensed soil evaluator. set up in such a way that there is a mandate that if you are going to sell your property, your septic system and your septic system has to be in working order, okay, before you make the sale of the house. Right? If it's inspected before you're going through the sale and your system is found to be in failure, it is the owner's responsibility to fix it, whether that means replacing the entire tank and finding a new leach field someplace on the property. That's something that the homeowner is going to be responsible for. They cannot sell the house until, or the dwelling, whatever it is. If it's on septic, they can't do anything with sale or transfer until it passes a Title V inspection. This time of year, there are a lot of them that goes on. If you want more information on Title V general information, I do have a web link down here. It's the Mass DEP. Their website has lots and lots and lots of information on Title V and septic, and exactly what the laws are. There are so many of them that yeah, I don't have a photographic memory. I go back and reference this when I have questions because I'm not sure how something is supposed to go. Just go to the website, usually find the information that I'm looking for. Okay, this is what a typical septic system looks like. If you have a septic system, you probably already know. Okay, waste comes through the house, ends up in your septic tank. When it reaches a certain level, it drains off into your leach field. Okay, what happens in your leach field is the dirt acts as a purification unit. It filters down through the dirt until the water becomes clean. Okay. That's how a septic system should work, ideally. System failure. Okay. These are just a few examples of some indications that your system might be in failure. If you open up your D-box and you find a lot of scum in there, okay? You may have had a breakdown of the anaerobic bacteria that create the process for breaking down waste materials. Right? That's a serious problem. That's an automatic failure of your system. Right? And then you're responsible for putting a new one in. Drain field or leach field failure. You start seeing water above ground, your leach field has failed. Probably goes hand in hand with the failed septic system as well. Whenever you see in your leach field water that's above the ground, it means that that area is supersaturated. It's no longer functioning the way it's supposed to. It needs to be replaced. And that's going to, if you put both of these together, if you see both of these in the same thing, that is replacing your septic system and also finding a leach field somewhere in your property. Gets into a lot of money, too. People can pay anywhere, depending on the size of their tank, they can pay anywhere from $10,000 to $50,000 to replace it. It is a costly proposition. People who are on septic, who own a septic tank, need to have some knowledge of how it works and how not to abuse the system. We want it to last as long as it possibly can. We really want to replace it. Okay. Another thing that we deal with, noisome trade. Noisome trade can be a number of things. Here's the definition for noisome trade. Any trade or employment which could be harmful to the inhabitants, injurious to their estates, or dangerous to public health. And it could be, it might be attended by, injurious odors. Sometimes it's hard to tell exactly what an injurious odor is. Typically, when we talk about noisome trade, the primary target for that are pig farms. Pig farms are notorious for having complaints launched against them. This is an actual place that was inspected years ago. I'm sure many of you know who the individuals involved are. They are still operating their piggery. It's a little bit of an iffy situation. Okay. And you can see, the pigs up here, they've got stuff scattered all over the place. There's, a pickup truck out there doing work. This is the shed. This is the first time I'd ever seen them actually cooking food for the pigs. when you're feeding pigs. You need, any meat scraps or anything like that have to be cooked. I think that the guy knew that we were coming for the inspection and this was done for our benefit, but whatever, okay? It was being done, that's fine. A lot of times you're going to get a standoff like this between your health agent and the owner of the operation. You're not necessarily going to see eye to eye, and the owner of the operation, may take, particular exception to something that the town is telling them that they have to do. Happens. I mean, can't always get along. Oops. Skipped over food establishments, but another thing that we inspect are food establishments. Okay, here's the guidelines for restaurants, food establishments. Check your food when it comes in. Make sure your food is clean. Separate and segregate different kinds of foods. All right. So don't put your meat products over your vegetables. All right. If it starts to drip, it's going to contaminate whatever happens to be underneath it. Cook it to the proper temperature. Always make sure that things are being cooked to the proper temperature. If it needs to be cooled down, make sure it's being chilled down and cooled down properly. Okay? And if it's no good, throw it away. All right? The picture's interesting because there is a violation in the picture, but there are things that he is doing right. And I don't know how visible it is to everybody. What he's basically doing is, it looks like he's cutting up chicken. Okay? The good thing here is that he's doing it on a piece of paper, because that particular surface would be very, very difficult to clean if you're putting meat products on it and cutting it up. You could potentially get bacteria into little grooves or crevices. It's not easily cleanable. So that's not a bad thing, and he's doing it on some sort of a sheet of paper. The violation here is that he's not wearing gloves. Okay? Whenever you're handling raw meat, someone that's in a restaurant is handling raw meat, they need to be wearing gloves. Okay? Potentially what could happen here is he could go from doing whatever he's doing with the chicken, cutting it up, to not wearing gloves, and then he's going to go work on salad bar. Same hand, didn't wash his hands, he's going to work on that. Potential for cross-contamination going on. You want to avoid that at all costs. Pool inspection is another thing that we do. I myself am not a certified pool operator. I know enough about pool inspections to be able to tell you if it looks like something's wrong or something just doesn't seem quite right. You want to check and inspect for the proper level of chemicals in the pool. All right. The Virginia Graham-Baker Act. Does anyone remember what happened with this and why this came into law?
Wasn't there a child that was sucked into a drain?
You got it. Okay. Little girl got sucked down into the drain, got stuck at the bottom of the pool, and essentially because the suction was so heavy, she was basically eviscerated. Okay. Her mother pushed to have this act signed into law. It was signed into law in 2007, okay? That every public pool, commercial, recreational, whatever, has to have an anti-vortex drain installed in it, all right? If it doesn't have one, the pool gets shut down until you're able to put in anti-vortex drains on these things. Note, though, there is no oversight of private pools or hot tubs with this, all right? We're only talking about things that, pools that the public has access to, commercial and recreational, right? At this particular time, most pools now are equipped with anti-vortex drains, as well as an emergency shut-off on it in case something goes wrong. Pools previous to this did not necessarily have those things. Recreational camps, fun stuff. 105 CMR 430 basically governs what goes on at recreational camps. The three big things that we look for when we start camp inspections are criminal background checks on the counselors. That includes a CORI and a SORI. Okay, everyone know what a SORI is? You don't know what? Okay. A SORI is basically telling you whether or not that person is part of the sex offender registry. Okay? Anybody who is convicted of sexual molestation of a child automatically goes on the sex offender registry. Okay? It's important for recreational camps to not only do the criminal background check, but also to do the SORA check on them. You want to keep the kids safe. Right? Immunization records. Make sure that the kids have been immunized against things that they need to be immunized against, things that are potentially transmittable from one kid to the next. Measles, mumps, rubella, pertussis. Those are all things that we need to have immunization records for. And then they have to undergo an inspection. The inspection is we want to make sure that everything is safe. Right. There are a lot of things sometimes that go on in camps that are a little questionable for activities. That's when the inspection part comes in, because you want to make sure that they are doing things in a responsible fashion. Now, I'm just going to run through these next few slides really, really quick because we're running a little late on time, but also some of these things don't necessarily apply to Ashfield. But these are things that we do tend to oversee. Hot tub inspections, we do that. Okay. They have to be permitted by the Board of Health. The chemical level has to be tested. Tanning and other things that needs to be permitted by the Board of Health. I don't know if there are any tanning salons here in Ashfield. But anytime someone is being exposed to that degree of radiation, these things need to be checked to make sure that they're in working order. Okay. They also need to be inspected to make sure that they're clean from one user to the next, because you don't know what the first person had that might have left behind. The next person goes in and picks something up. The biggest, of course, the biggest concern, is exposure schedules and how much radiation the individual is being exposed to. Whenever you're dealing with radiation, there's a threshold limit for what people can be exposed to, what is considered a safe level of radiation. Body art. Again, I don't think that there are any tattoo parlors here in Ashfield or any piercing studios, but local public health oversees this too. Anything that has to do with body art or body modification, whether it's tattooing, whether it's getting a belly button ring, getting a lip ring, getting an eyebrow ring, having anything else that is kind of cosmetically done for body modification has to be overseen by the Board of Health. Some of the things that I've seen people do to themselves, I think are just a little out there. But people can choose to do what they want, with their own bodies. We are simply concerned about, we don't want infections to be transmitted. We want to make sure that things are done in a sterile environment, that the operators are wearing gloves, that they are not using the same ink pots from one customer who sits in the chair, gets finished, the next one comes in, and they're going to use the ink pots again. Okay? This is a really, really good way of spreading hepatitis, or even potentially HIV, because there is some blood exchange going on here. Those particular machines, when the tattooing of one individual is through, the needle needs to be thrown away. Okay? Comes red bag waste, they swap out the needle for a new one. They get rid of the old, little cups that they have to paint in. They start all over again. Okay. I'm going to rush through this one a little bit too. The only reason that I'm bringing this one up is because it's becoming particularly relevant again. Back in 2001, if we remember, there were the anthrax letters. There was a great deal of terrorist activity going on. There were cases of chemical attacks, not necessarily happening in the US, but I think, does anyone remember when there was the sarin gas release in the Tokyo subway? Okay, that's a chemical attack, basically. Sarin gas is nasty stuff. All right. These are things that the board should be aware of, because sometimes, in some situations, first responder to this, all right? If you're the first responder, you're the first person on the scene. When you have this kind of thing, going on, you need to know what to do, all right? And sometimes it's a little bit more to help that picks up on it, okay? Local public health will, run the show for a while until the next more qualified person comes in and can relieve them of that duty. But you'd be surprised at how many times the local board of health turns out to be the first responder in an emergency situation. These were actually taken at a training that we had that was put on by OSHA. Health agents in surrounding towns actually got to see what it was like to dress in full PPE gear, okay, in level A suits. These are level A suits. This one, not so much. This is probably level B. This is certainly level A. That is certainly a level A. A level A suit is entirely encapsulated, all right? You get your air source from carrying a scup pack, right? And you have SCBA gear underneath that. That's how you're breathing through it. And that is the highest level of protection that you're going to get. Right? Unfortunately, these suits don't come in reasonable sizes. They assume it's kind of a one-size-fits-all. So for particularly small people, you can end up suit covering around your ankles. Makes it difficult to move. But this was an important training for health departments to understand what it's really like to have to get into something like this, and how cumbersome it is, and how difficult it is to move around. Okay, we respond to all kinds of emergency situations. Large animal rescue. This is something that the health department may get involved with. Is having to do a large animal rescue. This, by the way, is a staged rescue. There is a team that comes from South Carolina, and they use live animals to do this. The animals are very, very specially trained to be able to put up with a lot of nonsense that goes on with this, such as putting them in a mud pit, getting straps under them, and then raising them up in the air on, basically with buffalo. Okay. It's good practice when you do a plaster courses in ice throw and these guys have to move on mindfully on. Okay. Another situation we could respond to, this is a meth lab. That was in somebody's basement. Again, as the Board of Health, you may be the first responder to that situation. Okay? So those are all things that you might encounter. Those are all things that the Board of Health could potentially be involved in. So you can see that you have what the kind of vast range of knowledge is necessary. You have to know, a little bit about a lot of things. Okay. When we're talking about, biological attacks, that sort of thing, anything that looks suspicious these days, we're getting ricin letters, wonderful. What happens is, materials are collected. Sometimes it's the local Board of Health that's going to be doing this. They're going to be going out there, they're going to be picking up the samples, taken to the state laboratory for testing. They're inventoried and tracked. Okay. Interesting to know that as of November 20th of 2012, there were over 2,000 samples that were tested for anthrax, and they were all negative in the state of Massachusetts. That's good. People tend to get a little nervous when they find little bits of white powder in things. I often joke, because during those years I would get a lot of calls to come down to the police station because we have a suspicious package that has white powder in it. And I've always wondered, over the years, how much cocaine did I actually traffic from the police department to the state lab because it's white powder? Anthrax, by the way, is not a white powder. It is actually closer to a light brown or tan color. Okay. just something to know. So not every white powder that you happen to see is potentially anthrax. Okay. The results are reported to local and state authorities. Keyword to all of this is planning. Okay. Planning is very, very important. Have some kind of protocol in place. Have some idea of where you're going to go with, if this happens, then we will do this. Okay? This is a good example. Not good planning. This is UMass. I don't know how they managed to land that thing on the island there, but, you know, okay, good for them, it didn't land in the middle of the road. But, you know, still not very good planning for, I'm sure they didn't plan to come down there. Okay? But planning is a key word for all of this stuff. Have a plan. Have a contingency plan for what you're going to do. How are you going to handle the situation? Any questions? Questions? Suggestions? Comments? Okay. We all probably remember seeing these pictures from the SARS epidemic. But there you go. That's basically public health, local public health in a nutshell. There's a lot more to it than this. I'm trying to keep it abbreviated as I possibly can. If you have any questions, if you want to know more about something that I talked about, if something wasn't clear that I talked about, please feel free to ask me. Even if I don't have the answer for you right up front, I'll find the answer for you. Okay, or I'll track down somebody, you know, who is likely to have the answer to your question. So please, I mean, don't hesitate to come to me or any of the members of the Board of Health and ask questions. Okay, that's part of what we're here for, is to help you out and to answer some of the questions. There we go.
Thank you.
Okay.
Very interesting.
Thank you.
Excuse me for just a second, I need to call my roadie to the new town. IT wizard.
Oh, Alan's.
You said you did.
No, I didn't see it.
No, Alan Rice's.
Oh, yeah, let's just go right there.
And I figured Tucker was here, but. Alan?
Yes. How are you? How's everybody doing? How's everybody?
Susan Clark.
Susan.
How do you?
Buddy Lucas.
Good to see you. How
Buddy is our agent.
How's everybody doing tonight? So, I am here to representing the Open Space and Recreation Update Committee. We're trying to get the town's open space and recreation plan updated per state requirements. And one of the key pieces of this, and you see you have it, but I have a different handout that might be a little bit better formatted, is to get the 5-year action plan updated. And this involves all the various boards and commissions of the town, including the Board of Health. If Board of Health sees that there's places where you might have some objectives and some action steps that you'd like to see taken over the next 5 years. So I have a, let's look at this one. This is a little, I formatted this a little different. This is,
I actually did not look because I had this. I didn't look
okay,
at-
well, we can take that too. And this is a, this is from the 2008 draft of the plan. This is where the plan left off. And as you can see, there's, if you look through it, there's 5 goals. Goal 1 is protect the natural systems that support wildlife and provide clean water and air. Goal 2, promote active farming and forest management. Goal 3, protect Ashfield's cultural heritage and scenic resources. Goal 4, promote recreation that is rooted in the rural landscape. And 5 is zoning policies, planning that respects the town, respects the resources as the town grows. And then you'll see there's various objectives in each goal, there's action steps, and who is taking on these. Some of them are blank, but I've been meeting with all the boards and commissions of the town. I think you're my 4th or 5th one now. And the question for you is, do you see anything in here, or any objectives that you think the Board of Health might want to be involved with or take on, or does the Board of Health have any objectives of their own, of its own, that it feels would be a valuable contribution to this 5-year action plan? And just as an example, if you look at other open space plans for the state, a lot of the action plans that involve the Board of Health might include things related to water quality, for example. Testing of streams, lakes and ponds, looking at well water quality, watershed water quality, taking action against any pollution or sources of pollution, even taking action against invasive species, plant species, delineating aquifers, developing various kinds of information programs for the public on things like well water protection or groundwater protection. These kind of things that might be something that the Board of Health might want to address. The handout I just gave you doesn't have any Board of Health responsibility listed in it as of now. That doesn't mean that the Board of Health can't be responsible to take action or want to be involved in this. So I'm here tonight to present this to you, to make sure you have a chance to look it over and see if and where you think the Board of Health might fit in to this 5-year action plan. So I see most of what you might be involved in falling under goal number 1, which is having to do with providing clean water and air. But there may be some things that I'm not seeing that you might want to take into account. So any questions on that? Does that make sense to you?
For the most part, I mean, we may be interested in all of this, but the Board of Health is primarily, I would think, interested in clean water and air.
Right.
We want to protect our aquifers and
Right.
a clean source of water is certainly something that the Board of Health is concerned about.
Right. So I think maybe if you were to just keep this on your agenda for the next several meetings. And take a look at the handout and put in your own objectives if you see fit to do so, and make some edits. And there's one important thing that you need to know that's not listed here. As you can see at the end, it says, when does it start and who's responsible. So you can see, for example, in goal number 1, the objective is to guide protection of rivers, streams, ponds, wetlands, floodplains. You'll see that the Conservation Commission is taking responsibility for those action steps. Now, I've met with the Conservation Commission, and they hopefully have done their homework and are making their edits. I'm looking over at Brian here. And he's giving me a look like they haven't quite got there yet.
We're working on it.
We're working on it. Okay, good. That's good to hear. But also, in the new format, what we have is the start date, and then if you see a foreseeable end date, or it may just be ongoing, maybe indefinitely. And also, the state is requiring to list whatever potential funding sources might be. So let's say you do want to do some testing to conduct a delineation of aquifers, or I'm just throwing examples that may not be relevant. How could that potentially be funded? Grants, donations, in-kind, volunteer. So that's something that would need to be added to this. And if you were to work on this in the next couple of weeks, make your edits, then I'd be happy to take those edits, type them up, and incorporate them into the 5-year plan. So I'm trying to make this as easy as possible, representing this committee that's responsible for making sure this 5-year plan gets updated. The body of the document is being updated through Dodson and Flinker. They were the original authors of this document. And then there's some revisions that need to be made to map it. And I'm not sure if any maps here would be relevant to, maybe there's some water, there may be a water map here that you might want to take a look at. But in order for this plan to really have some teeth to it, there's got to be some objectives, and there needs to follow through on those objectives. And that's why we have to update this. It's very important that we look forward to the next 5-6 years so that this doesn't just sit and not be a valuable document. We are a little pressed for time. This is due sometime in July, which has gotten me worried, but that's how these things fall. There is a map here that shows water resources, and if you want, I'd be happy to leave this with you right now. I need to get it back. If this is something you want to look at, if this is helpful to you. These maps are about 16 or 17 from included in this document, probably as an appendix. You know, if this is something that might be helpful to you, if your interest is primarily water. Do you know what I mean? I'm not sure if any revisions would need to be made to this map. I'm thinking not, but there's always that possibility. There's some resources back. There's resource priorities, cultural resources, cultural resource inventory, and then we're going to priorities. Composite maps, put it all together based on what is shown: water quality, topography, soils.
We showed this went through well.
Good.
This went through well, and another one. There should be a little right there. know if that, how much that qualifies as a transient non-commuter.
What's it used for?
They show golf course.
For the golf course itself, yeah.
And there's the school.
This is,
See there, it says, see it? Yep. Well, the school's it's an office. I don't know if,
no, I'm happy to leave this map with you as long as I get it back. If you want to scrutinize it, make sure everything gets on there, should needs to be on there.
Craig's, where is it, Joe? Is that a Craig's Road? That one probably isn't there. I'm not sure that it's that critical. I mean, keeping the water clean in general is a priority.
Right.
I don't, unless you want to look at this, I don't necessarily see this.
This seems to be pretty thorough.
Yeah, it looks pretty thorough to me.
Yeah.
Yeah.
Okay. So, any other questions? Does this all make sense to you? Or?
So you would like us to look this over and then talk about it at the next meeting and see if we come up with anything?
Yeah, see if there's anything that you think you might want to add in terms of objectives. And then if there are any other objectives, you need to put some action steps to that. Maybe there's something you already have in the works that could be added. If so, you want to put when the starting date was. If you have new objectives, the starting date would be this year. And if it's something finite, you want to see if you have an end date, a goal of when to complete it, or it might just be ongoing. It might be something that's always happening. And again, if it's something that might involve new sources of funding, you have to list that. It's one thing that's different that the state is requiring in this update. So you want to see a column that shows potential funding sources.
I'm not sure how much funding we're going to come up with.
Well, meeting with the Ashfield Trails Committee, it was all about mostly private donations and volunteer work. Conservation Commission, there might be some grants in there somewhere. But everybody is doing their homework on this one. It's not the planning board, Concom, Parks Commission's in there, Ag Commission, Historical. So I'm trying to hit everybody.
When in July is this due?
Oh, I think it was the 13th.
Oh, upstairs. Is there like more time?
To look
Look
at.
this over and think about
I
it.
think it might be through the entire month. I'm not
Okay.
exactly sure, but yeah, it's the deadline is ASAP. We want to try to finish this as soon as possible,
Right.
so we can get it submitted.
Works for me, Alan. Thank you.
Okay, anything else, or I have
Thank you.
a couple other.
Do you have another one of these?
I have two more for that. Why don't you take them both?
Okay, just do the board member wasn't.
Sure. Sure. Okay, well, thank you very much for your time. Appreciate it.
Thanks for coming in.
No problem. Some funny stuff falling out of the sky this afternoon. I realized that when I heard the thunder. All right, well, thanks. Have a good night.
Thank you very much.
Thanks, Alan.
I forgot to punch the bell. Sorry. Sorry. No.
Sort of reports, inspection reports, that kind of thing.
Oh, yeah. Gosh,
have his payment and his.
Yeah, you could use here.
Yeah, that there.
But we're all right, you can do it.
Oh, yeah.
I saw you.
Oh, it's pristine.
Yeah.
Yeah, there were no problems with it. That was very, very easy to do that. There was an inspection of Kachina's apartment on May 3rd, as well as some of the common areas of the Ashfield house. Susan was there, Paul Hoffman from Central Mass was there as well, Tracy Minor, and I don't forget. And besides Katrina, I don't think. Okay, thank you. I just got finished writing up the inspection report for that. There is a new inspection date scheduled for June 3rd, so basically giving them 30 days to correct the violations that were found.
Okay, so you, in the letter, you told them the inspection will be.
Yes, yeah, and I also told them that verbally when I was
Okay.
there, that I would be back within a month to make sure that these things were being corrected. A ton of things going on. I'm a blank. I can't remember a single thing.
Would you start with it?
Yeah, it was.
Oh, you went to.
Yeah, it was Robert's.
You did the resident kitchen, but you also did Sanders.
That's right. Oh, that's right. I did. Yeah, that was. I wasn't able to be in the last meeting, so I think that's where. Yeah, I did Sanderson. Sanderson was fine. Looked great. Front Porches is no longer bed and breakfast. She's not operating anymore. Interesting thing that I just found out recently is that Earthworks is back on the radar.
Mm-hmm.
They are evidently going to be doing something here in Ashfield in August, and that was not on their calendar previously. I need to get back in touch with them and talk with them a little bit more about what they're planning to do. I understand that one of the classes they're going to be holding is how to skin and tan hides, which is interesting and kind of fun. I'm not sure how appropriate that is, but it seems that in talking to a number of different people from the state, it seems that the towns that they had been advertising in, where they said that they were definitely going, are giving the boards of health a lot of pushback on this, claiming that they don't need to be permitted for certain activities, or they're not really running the camp. I think that there is going to be an effort from state officials to send out letters basically to all of the towns in this area that are potentially affected by them, which is basically going to be a cease and desist order. They're not allowed to do it, not until they meet the state standards for it.
So, I'm a little bit confused. So the towns are giving the boards of health some flack about?
Oh no, it's not the towns, it's Earthworks program. When they're being told no, or that they need to pull a permit, the boards are getting a lot of pushback from them. And changing their story, changing their story as to what's really going on. So that being the case.
So are you saying that the state is going to be issuing them a cease and desist?
That's what they are going to be trying to do. They're trying to get authorization right now to send to the local boards of health basically a template letter that is going to come, like for example from Ashfield. It will come from the town of Ashfield basically as a cease and desist order, and you are not allowed to do this in our town. and I know that, a number of towns are probably already beginning to do something like that. But the people that I've spoken with from the state, Dave Williams, they feel that if the order is coming from the state and going to the local boards and local boards are enforcing it, well, it's a state order. That they cease and desist. We're just backing them.
Okay, so we
saying
may
not,
see that.
Yeah, we may see that coming.
Okay.
Meanwhile, I'm going to try and get more information on what's going on here in August because they had not been on the calendar.
How did you find out something was potentially going on in August?
I spoke with Dave Williams and he said, by the way, they're going to be in Ashfield. And
Okay,
well, last time I looked at the calendar, there was nothing there. And he said, we'll go back and look again because now it's up. And when I had...
Okay, so it's on their website now?
Yeah, it is on their website now. When I had initially spoken to the Earthworks people, they had told me that they were not going to be doing anything in Ashfield. That changed, evidently. They're a little slippery.
Sounds it.
So, yeah, this is going to be, a lot of, chasing them down to enforce the regulations on this because
Yeah,
they're trying to sidestep.
I can see how, if they're only doing a weekday camp, they feel like they don't want to jump through all the hoops. But on the other hand, when you're licensing recreational camps, if they have people helping them, who's helping? If I was a parent, I'd want to know that somebody's
it's the health and safety
providing
of
some
kids.
oversight.
That things are being done properly. If they're providing food to the kids, I need to know where it's coming from, how we're doing it.
And this is coming up pretty
In August.
quickly.
So
for all these area towns, if they're going to be doing things throughout the summer.
Yeah. Yeah.
When do you expect to hear from the state?
Hard to say.
About,
Hard to say. They were very vague
okay.
about it. This is something that they want to push through as a state mandate. They don't know when it's going to happen or if it's going to happen. So if it doesn't happen through the state, then we can issue the order for the town. Just on our own and tell them that you can't do this here. Not without calling a permit. Regardless of what kind of a camp you're operating, you still have to have a permit. And you need to pull a license from us. Even if it's a day thing, they still have to have it. And if they refuse, then it's going to turn into a cease and desist. And if that gets ignored, well, then we take it to the next level.
This is just a question, sort of tangential to this. What about churches that do like Bible camps in the summer for a week? That's a day camp kind of thing. Are they also pulling permits?
They
should be.
I think that they should be. I think they should be, but let me look into that.
I'm just curious.
But that's a good point. It's a really good point. Thank you for bringing that up because I'm not really sure. They should be. Technically, they should be. But let me look into it and see if I can find more information.
I don't know that they do any here in Ashfield. I don't know. But,
yeah, some towns do them. Other towns don't. But I'll ask a few more questions and then find out more definitively what the rule is for that kind of thing. So yeah, Earthworks is back on the radar. I am still waiting to hear from Cecilia about the farmers market vendors. I sent her 2 emails now requesting the names of the vendors that are going to be there with prepared food. And I haven't gotten anything back. She could be busy.
Probably is, if you may not have a final list either. She may be still working on that.
Yeah, she might be. I think she indicated to me that she had a list from last year that she could provide me with. But so far I don't have anything. And I really need her to get that to me sooner than later because the farmer's market is going to start pretty soon.
I think in our files we have a list from last year.
If you do, that would be great. That's a good starting point.
It's a starting point, yeah. I can get that to you.
Okay.
And I know the list that Cecilia gave last year, there were some people that showed up that weren't on that list. There were
Right.
some people on the list that didn't participate,
Okay.
but for the most part, it
Okay.
was
Okay,
fairly active.
that's good. I mean, it gives me a starting point, and at least I can send a heads up letter. to
Yeah,
to
and
some
I
of these people
had,
saying, by the way. if
A
you're-
lot of them had emails. So
Okay, good.
email addresses. Most of them had email addresses.
Okay, great, that's fantastic.
So at
I
least
can
get
do a
that
mass
to you so
mailing
you
that
can-
way.
so you can at least get started on
Yeah.
that. Cecilia
Yeah.
is not
Okay.
responding.
All right. Yeah, I really want to see them get permitted properly, and make sure they're serving ready to eat food, that they have at least a residential kitchen license and serve safe. And they also need a permit to do it. Do you charge for permits for the farmer's market, or is
We
that?
charged $10 for
Okay,
permits for last year anyway.
that's for the whole season?
That's for the season. And I don't know if you noticed, Duncan, but they're starting the weekend before Memorial Day weekend this year, like not this coming weekend, but the weekend after.
Okay.
So it's pretty soon. I think that's the 17th.
Friday, it's Friday.
Oh, it's the 18th.
It's the 18th. I may or may not be able to be here.
So when is
Memorial Day is early this year. It's the
27th.
I guess it's not that early. 27th.
oh, so they're doing all right, 27, oh, so we get included.
Yep.
And they run every Saturday?
Yes. And they were doing 8:30 to 12:30, but I believe in the Ashfield News now they are doing 9 to 1. Maybe I'll double check on that though.
I've got a schedule conflict on the 18th. Out of places for July. But for the following Saturday, I think I can shuffle some people around. See if I can get some on Friday instead. Bring that a little bit.
Well, the other thing is that a lot of times will start and not everybody will be geared up for that weekend.
Okay.
And we get more people
As time.
as time goes
Okay.
on. So there's a certain amount of fluctuation
Okay.
in there.
Yeah.
Yes, and I have an inspection coming up on Monday the 20th. I do not know how to pronounce this woman's name.
Eka Kursak. She's participated in the
Okay.
Turkish.
Okay, all right, yeah, I have an
Oh, you're
inspection.
doing a residential
Yeah,
kitchen?
yeah, I'm doing her inspection at 10 o'clock in the morning, Monday the 20th. So, that's another document.
You know, at some point, Corey, Doug Pease wanted me to talk to you about just having a look at the property. It's not next to the lake house. If you, it's the lake house,
Yeah,
and then there's a whole bunch of cabins,
yeah, yeah.
most of them belongs to Doug Pease.
How do you spell that last name?
P-E-K-S.
PAC, and there's one woman that owns a house that's right next to the lake. It's almost like a little point here, and her name escapes me at the moment. But she's got a trailer there. Actually, she might have a couple of trailers there, and there's a certain amount of junk hanging around. Her trailers are
I think I may have seen that in
You
passing.
probably have seen it.
Yeah.
And that's what he's complaining about. And I don't know if there's anything there that, whether it's a violation or not, but I promise
Yes.
Get on and look at it.
Yeah, that is a violation. With the amount of stuff that she has in her yard, it's a harborage for rodents and insects. That's a problem.
All right, well, that's something that I'd like to
So,
look
yeah,
at.
I'll look into that. And do you have his number? Do you know? Or is he in the book? Or
Which one?
Doug Peace, do we have a phone number for him? Or?
I'm sure it's in the book.
Okay, all right, then I'll just look him up.
And like I said, I don't remember the name of the woman.
Okay, I'll talk to him first, find out what's happening.
Holly Gass is the name. Holly, Holly,
Holly.
Gass, Gass.
So what I'll probably end up doing with that is collecting the information on the complaint of what's going on.
Yeah.
Then I'll send her a letter for
Okay, well, that's the thing, rather than get his complaint secondhand from me.
Right, I'm going to talk to him,
Okay,
yeah.
there you go.
And after I speak with him, then I'll send her a letter for notice of inspection
Yeah.
for the property. And we can go from there on what needs to be done and whatever orders need to be issued. Hopefully,
Well,
we'll
that's
get.
something you could have picked up on when you were down there, then.
Yeah, I saw that, and I wasn't sure about it. But
Yeah.
okay.
Anything else you can think of?
Not presently, no. I think that's probably about it.
Well, moving right along here. It's 8 o'clock, I would just assume. Move right along if that's fine with you. And I'd like you to stay in here until we do the mail, because there's some stuff in there that I want you to look at it.
Oh, sure.
But approval of the minutes shouldn't take long. I'll tell you right off the bat, these things look pretty good to me. I didn't have any exceptions.
Okay.
So do I hear a motion?
I move that we accept the minutes of the April 16th, 2013 Board of Health meeting.
I'll second it. Motion being made and seconded. Those in favor? Aye. Unanimous. Now, was there another meeting minutes that we wanted to do something with? Revisions of March 12th or something?
I think we should hear all those.
Okay.
But I'll check, but I'm pretty sure we took care of all of those.
Trash disposal update. I got 50 of the containers. I don't know if you want to look at those.
Yeah, you just got them today, right?
Tuesday.
Tuesday, okay. Okay, are they here?
Yeah.
Oh. You gotta go in. Get them, show us. Show them.
Where's the cemetery in Baptist County?
Oh, if you go down this one road, you can't miss it. It's not too far outside of town, it's on the way.
Okay. We're having a problem with dogs, I see.
Well, I liked your presentation, Lisa, of the early boards of health.
Went and cleaned it up.
Responsible for cleaning up the waste. Definitely,
Yep.
we need to get our,
Get the pooper
yeah.
Cats. I was curious about this. Joanna.
Yeah, she had heard from somebody,
Okay.
one of the neighbors.
Okay. Might be better to address this sooner than later. If the cats are causing property damage. Who was the original complainant? Was it Mrs. Gambino?
I believe so, yeah.
Okay, so she was the original complainant. I don't imagine we've heard anything from them.
No.
Okay. Do we know anything about the cats? Are these feral cats?
cats that Joanna brought up at the last meeting, the cats that were, are they the cats from the Dodsonville? Do you want to give Mrs. Gambino, or do you want me to give Mrs. Gambino a call?
Yeah, okay, I can just as easily give you a call, but if she's having problems with the cat spraying, et cetera and so on, then it might be better to address this problem sooner than later. How the cat's spraying. Oh, very good. Yes.
It's called Sharksigator.
Okay, so sorry. Afraid that last problem.
And that answers our question about whether other kinds of containers other than this can be,
Right, we give these to
whoever wants one.
whoever wants one. But then if people come in with a detergent bottle full of syringes.
And then
Makes
does this go inside the cardboard?
I'm not sure. You put it in the cardboard, you go
Or are they just put it
separately.
directly?
Sharps container slide. Recipient or objects pontus et tranchants.
That's French.
Somebody uses instructions. And then there's this.
It wouldn't take very long to fill that out.
Probably not. Looks like there's some junk in there too. But anyway, this is something.
So we have 50 of these at this point.
We have 46 of them.
46, okay.
Well, we started out with 50. I went in to
Oh.
talk to Mary, and she gave away 4 of them.
Oh,
While I
good.
was in there talking to her for 20 minutes.
Oh, good, okay. Good.
But this is something, did you push it down?
Yeah, I
Right.
snapped it shut.
One, I've got.
And while we're talking about that, Deb, you had sent an email about the Sharps containers. And a question about, apparently some people in town have arrangements where their healthcare provider or whatever is taking those.
That's great.
Free, and
That's
people
fantastic.
have the right to do whatever they want.
Oh, yeah, if that's a convenient thing,
I mean,
then that's
You
fantastic.
continue to do that, that's
Right.
fine.
Yeah.
So, but I don't think everybody has a healthcare provider who's willing to do that, so this offers an alternative.
Well, I mean, the other thing also is that, I know that you have farms in town. Anytime you have large animals, there are very likely going to be the presence of needles and syringes, for administering medications and stuff like that. Generally, the vet doesn't take care of that for you. So,
Oh, even if the vet comes out, do they use the
oh yes,
stuff?
oh yeah,
Oh,
Oh, yes.
interesting, okay. Well, maybe we need to put another notice in the Ashfield News directed towards farmers who are using these and so on.
Yep.
yeah, if they're using them, if they're vaccinating the cows, if they're vaccinating the horses or administering medications that have to go through a needle, they generally don't have a way to dispose of them. I know that we don't. The vet just leaves everything with us, and that's that.
Well, the vet doesn't even take care of it?
Wow.
Well, I know a lot of farmers will do injections without necessarily having a vet do it.
Yeah.
Oh, yeah, and we...
But anyway, yeah, this is all part and parcel of this business.
Right.
Okay. I'm sure you're familiar with the state regs, and if you're not, I've got 3 copies of them that I'd be happy to give you some paper.
Did you
Sure.
talk to Chief Droney about locking this up in his?
I have not. I was going to talk to him Tuesday evening, and I haven't been down here since.
So,
So
put
that's
that on your
something
to-do list
that's-
also.
that's-
Okay.
Is on it and has has been on it and is on it. The only other thing is whether we want to vote to, because I signed that contract with Cherry Cycle to take these things.
And it's is it a one-year contract?
I'll have to look at it and see.
Short term.
I think it's a one-year bid. I don't think it's 1 year because I told them that I was over, we would need it more than once a year.
Yeah, yeah. However, if people are bringing in large detergent bottles, that may be helpful. We're just going to have to monitor it
Well,
and
that's
see
the
if
thing,
it's
right, we're going to have to see how it goes, but do you want to look at that? I believe that it's on, it's in the email.
Oh, the contract that, this was, what was his name? Something Minor?
Yeah.
Rick Minor?
Joseph Minor.
Joseph Minor, that's right, okay. Okay.
Now, maybe this is something we want to wait till Michelle is here, or Shelley is here.
Okay, yeah, why don't we do that? Makes sense.
You know, I initiated if you will. But I
Okay,
think
why don't we do that?
Perhaps the
Vote on
board
that.
should probably vote it. And just to be official, if you will.
Okay. All right, that sounds good. And in the meantime, I will get something into the Ashfield News about
Get these things.
farmers being able to get rid of their.
Well, the other thing is we might want to talk to the Agricultural Commission and let them know, and they know what farmers are talking about.
Okay, yeah.
You know, what
Okay, I'll do that too.
to know about it. I would assume, Claudia, that they're doing the same thing in West Hampton, Southampton.
Oh, yeah, if we have the vet out,
Statewide.
yeah, if we have the vet out for any of the horses and it has to be injectable, we're doing injections twice a day, he just gives us a pile of needles and syringes and he's gone. So we're kind of stuck with them.
Yeah.
I can't throw them away.
Yeah, so you said is Southampton doing that?
They do some sort of a sharps collection day. I don't know how many people bring their sharps for the animals, but I know that they certainly generate plenty if you're dealing with farmers and large animals. And I don't know how they deal with that. I mean, ours just keep getting kind of stockpiled. Joy can figure out something to do with them.
Exactly. Okay.
Well, do we want to get into mail and correspondence?
Can I say something about the flu shot first? I had agreed the last meeting to contact the company that we got the vaccine from and order more. And I contacted McKesson, which was the company that we got the vaccine from last year. They had no record of Ashfield having an account.
Really?
And the woman that I talked to, who has been extremely helpful, she's called me back several times, said that they don't ship to like a board of health. They ship to a medical facility. So I'm suspecting that the state somehow had an arrangement with them to ship directly to the towns. It got to the point where I thought, well, maybe it wasn't this company that we ordered from. So I came into the office and I checked the files, and indeed the invoice was there. It was the company. The state of Massachusetts shows up as the grantee, whatever that is, with the shipping to Ashfield. So I made a copy of that invoice, and I'm going to give her another call. If I can't figure out, I'll also talk to Lois at the state level and tell her, hey, you're putting this in our laps now, and it's not turning out to be as easy to just order it as we had hoped it would be. So I just wanted to update you on that.
Here's the calendar. Do you have enough this in the mailbox?
Oh, Claudia, you and I went to the West Nile virus and the
Oh, yes, that's right. Yeah,
equine encephalitis
I
training.
forgot about that too. Yeah, that was a very good training.
Yeah, it was.
I thought that it was very good.
It was kind of scary because triple E, the Eastern equine encephalitis, the mortality rate, if you get triple E in Massachusetts, the mortality rate is 50%.
Yeah, it's high.
It's very high. I think nationwide it's something like 33%, but in Massachusetts it's 50% for some reason.
That's for what, horses?
Triple E, no, it's for people.
Oh,
Yeah,
It transmitted from mosquitoes
yeah.
that like a particular kind of swamp. White cedar. White cedar and red maple swamps,
Yeah,
which is
acidic water.
in the Plymouth area. There are, in southeastern Massachusetts, there's a lot of that kind of swamp. So they've done some aerial spraying there.
Right,
And
yeah.
last year they only had one case. The rest of the state had more cases than the area where it originally was so prevalent. So it was very interesting.
Yeah, it was. It was very interesting. Those particular types of mosquitoes tend to like cold water crypts.
did you want to modify this one?
No, I didn't. But I can.
Well, that's from the account.
All right, yeah.
Okay, we're talking about your mail now?
Yeah, I don't want to.
Check the date.
Let me just write that down for my dad. You were at his house
Second.
2nd of May. And his fee was what, Bonnie?
$25.
And there were no promises.
No, he was
he
fine.
on a database?
He was all good.
Excel spreadsheet.
Okay.
So the,
Yeah, I just
you
need
were
to,
just asked to give more
yeah, just put the inspection dates on.
dates on.
And unfortunately, I have those in my book. Okay, so that one's got a date on it for that one. And the rest of these took place on April 17th.
I'll see here and see if she wants to do anything about the some of these older ones, Claudia.
Okay.
And you know, it's just I think it's more to remind you in the future to put that on there.
Right, okay. Okay, yep, the dates are on that, so we are good.
All right, did you see this?
This is the Mohawk Area Public Health Coalition dinner, annual dinner.
Oh, I heard about it, I didn't go.
No, I
I was
didn't
able
go.
to go.
It looks like Joanne might. Oh, and she's got a handout on emergency powers of boards of health. Okay, so there's a handout from that one. Yeah, there's a
Yeah,
training.
that's really interesting.
I was planning on going to that in Northampton.
Yeah.
There's a training on May 16th in the afternoon from 1 to 3 p.m. Landlords, property managers, trustees, and tenants. It's open to those wanting to learn more about smoke-free living.
Yeah.
How to make the residential rental property or condominium building smoke-free.
Cheryl Savara is really good.
So there's that. And
She's
there's
really good.
medical marijuana workshop for planning, health, and select boards.
Okay.
May 29th, 6 to 8 p.m. at the Transit Center in Greenfield. Oh, there's an information sheet on AAA.
Yeah. And
Public health
sheets,
fact sheet
yeah.
on AAA. And
Yeah.
same thing. So, good.
The smoke-free.
Yeah, that's in Northampton at the Northampton Senior Center, 67 Conn Street, Northampton. May 16th from 1 to 3 p.m. Is that something you'd be interested in going to, Duncan?
Have you invited me?
Sure. Of course.
Well, remind me, yeah, I'd be happy to do that.
That
You
one.
probably will keep this calendar
Oh, yeah, my 5th calendar that
right
John
at
gave
the
us.
top. There you go. Well, it's handy to have a calendar here sometimes. It's really a shame that Michelle couldn't make it tonight, but
She had a family commitment that she had made a long time ago that she couldn't
yeah,
change.
it was indicated.
So. May 16th, 1 to 3, Northampton.
That should be very interesting.
Yeah,
And it's very relevant too.
well, the medical marijuana thing too.
Yeah, it is.
Opened a whole can of worms, haven't we?
Uh-huh.
Okay, that's May 29th. Okay.
May 29th.
6 to 8 p.m. in Greenfield at
Oh,
the
Greenfield.
Transit Center. And
Well, we've got a thing from Greg's wastewater. Looks like a Title V inspection on funding report.
okay. What else have we got there?
And there's a thing here for Michelle to fill out, but if she's not here, this is really far from the town.
Oh, okay.
I think that's something that,
Okay, W4 form and so forth, okay. I know she was sworn in.
does that say Laura?
I don't know. I can't read that. So.
Well, she mentioned to me that she would put something in my box for Shelley.
Okay.
And that there's no, we can leave it there for now. And it looks like something from the town of Ashfield to me, and it's probably a check. So I'll just stick that, or I won't lose it.
Oh, that's not Board of Health, that's
It's really not Board of Health, no.
personal, okay.
And something from the AG. We've got something from the NRA Solutions invoice. And people in the office looked at me funny when I said NRA Solutions invoice.
Yeah, I was
National
wondering that
Restaurant
myself.
Association.
Okay.
Oh. What is it?
I have no idea. I think it's one ship to one Elgin, not,
Oh, is this,
I have no idea.
we had this last time. This is Gloria Picosa's
Oh, yes.
documentation that she
That she did the allergy.
She did the
training.
allergy
Okay,
training
great.
online. Yes, that's, yeah, we went through that last time. But what's
we
that? Yeah. The AG's office.
Well, I haven't opened it yet, but I will. Reopen lot, open meeting law complaint from dear Ms. Nicholson. Thank you for contacting the AG's office. On May 6th, we received your open meeting law complaint dated April 30, which was originally received by the Ashfield Board of Health, and on and on and on.
Okay, so it's a copy of
We
an
will notify
acknowledgement
you of
letter.
our determination following our office's review. Essentially, it's boilerplate.
Okay. Just acknowledging that they received.
Acknowledging, yeah. So we did look at this last time. Oh, from Gloria, right?
Yes.
I remember. I
Yes,
remember.
because, yeah.
I bet this is an invoice from Carl. because it is.
Okay.
We did a Title V inspection on compliance. Inspection for septic tank replacement. And the well drilling, which is probably, well, let's see what it is. From an analytical laboratory. Coliform was absent, nitrate, nitrite. This is an inspection report. Mark Road. New well.
Oh, new well, okay.
Board of Health permit obtained. So something to be filed, I guess. If we've got a 376 March Road.
Okay. Into
Well,
old
good.
stuff? Catalog.
Catalog, career track, creative leadership for managers, supervisors, and team leaders. July 2013. They're doing something in Springfield on July 22, apparently, but they're doing other stuff too. I don't know what the hell it is. You can look at it.
Oh, I've seen this before.
This is not necessarily Board of Health focused, it's just leadership.
Yeah.
This is another one. Open meeting, thing from the AG.
Is that the same?
I don't know if it is or not. You can open them both and look. Well, one of them was dated April 24, the other one's May 7. But it looks like the same. It is the same form. There's different dates on it. See, the second paragraph is identical, or damn near identical.
Okay, this is about two different.
Yeah.
Okay. So that's again a copy of the acknowledgement.
I'll stick those in with the stuff in the OML file.
Can I just write down the dates of those while you got them out?
Yep, April 24. And May 5th. Or May 7th. How you want to get that? Yep. However you want to do it. And the free collection day, which is over with. You interested in this?
No. Oh, I'm sorry, did I take that away from you?
Oh, no, no.
green card there too, what was that?
That's your return receipt.
Oh, okay, okay, that was, just informed Gina about her inspection was gonna be, okay.
When we certified.
Okay. Okay.
And the only other thing I got left is this thing from Joanne. Apparently she made a copy of septic system plans. And usually I don't charge people for that.
Okay.
Well, this was in the...
Yeah, I saw that yesterday, she must have,
I have no idea.
to pick up septic system plans.
Well, she may very well have already
Okay,
put it in the, you know, well, I'll have to talk to Laura.
okay.
But that's it.
I'm struggling to get started on leave and training. It's a bad time of year.
It is.
Just sit at the computer. I will tell you that these minutes that we just approved, I finally was able to successfully put those on the Ashfield website.
Saw that. That was good.
So I will continue to work my way back and put
Yes.
more minutes on there. We had some technical things we needed to work out. Brian had to help me with that. So. Upcoming meetings. Okay, so let's.
I don't have any old business or new business.
Okay, no, I don't either. I had sent a message to Shelley asking her what would work out for her for a meeting in 2 to 3 weeks. And she said the 28th, which I know is a Tuesday. So I sent her another message to see if there was another date other than Tuesday, because I know you do.
Well, actually, hang on a second, because... If I have a student at 7:30, and if the meeting starts at 7, there's no problem. So that would be fine.
Oh, it's 8:30 in the morning.
Oh, 8:30 in the morning?
Oh, it's at 3:30.
Yeah,
Okay, I thought you said 8:30.
Oh, no.
Oh, okay.
If she...
But that's
Yeah.
not the 28th.
No, but if, I'm going back to this, because if she sticks to that schedule,
Tuesdays are a
of
problem.
Tuesdays
Okay.
at 3:30, and the meetings here start at 7, there's no
Okay.
conflict.
Okay. So should we shoot for the 28th? What's today? The 9th? Or the 21st? What do you think?
I would say something in the week of the 19th to the 25th, but it depends on what, see, the thing is, we've got to meet with her and see what her schedule allows. And then we can
I know.
kind of formulate a schedule around that.
What's,
You know, being a nurse, see, that's one of the reasons that we were doing a Tuesday was because Cindy had Tuesdays off. Because otherwise she wasn't.
yeah. What does the 21st look like?
21st is open.
Should we shoot for the 21st and I'll just, if that,
Well, we can say, all right, tentatively,
Okay.
or we could just say, ask Shelley
I'll send her a message and tell her, ask her if
if
that's okay. She does have a fairly regular schedule, but it alternates different weeks. And it's nights. She works nights.
Yeah.
So potentially, even if we had a meeting during an evening that she worked, she could still come before she went to work, because I think she starts at 11. I think she told me 11. But I'll send her a note and see if the 21st would work at 7 p.m. Okay, yeah, I'll send her a message tonight.
Well, the other thing is we need to, hopefully we could get Chloe a note and get a day and a time that's convenient for all four of us. Because I know Tuesday wasn't good for you, last Tuesday wasn't good for you, right?
Right, last Tuesday wasn't gonna work out because I had an afternoon lesson that usually, and because I had to be here for 6, lesson usually runs well over an hour. But if it's for 7 o'clock, then there's no issue. Because if she starts at 3:30, and even if we end at 5, it still gives me plenty of time. Because she's kind of mid-afternoon-ish. So, yeah, I mean, Tuesdays really shouldn't be a problem, you know, as long as she's sticking with those times. But I'll have to get something more definitive from her on if she's going to stick with that time. If she doesn't, that's okay too, because I can bump her onto a Sunday. But yeah, things are always subject to change on what's noticed with this.
Yeah.
Well, see, that's the thing, and if, depending on what Shelley's schedule is.
Yeah, I'll find out if that works, and then I'll send an email. I did send an email to Charlie Heath and asked him to remove Joanne's email from the Board of Health list and put Shelley's email on there. He said that Shelley has to verify that, but he's taking care of that, so. Okay.
And I can see, let me get the laptop back. This is not the current.
Oh, okay.
This is the one before.
Oh,
I didn't make a copy of.
oh, okay.
Well, as it turns out, that program that I don't like, you know, it spaces these out like far apart, and they fill 2 pages. But you can, I mean, you can condense it, but it's, maybe I should try to, I don't know, I didn't really, I'm pretty much remembering what my memory's halfway decent on that. I did type it up.
Okay. Oh, hunting pack, huh? Okay. So.
I know there's an F here.
Upcoming meetings, all right.
Yeah, we're somewhere down here.
Okay. All right, no, I don't have anything new.
You don't have any other
No.
comment? In that case, do I hear a motion?
Move to adjourn.
Second. Those in favor?
Aye.